Welcome everyone, and thank you for joining our webinar today. At Sebi Livestock, we believe that learnings are an extremely important part of the project cycle, and that the value of these learnings is greatest when they're shared. We hope that promoting these messages through our network, Livestock Data for Decisions, will increase the efficiency and success of investments made in livestock development and animal health. We've been really lucky to be working with the FAO's Veterinary Paraprofessionals project for several years now, and I'm excited for them and their project partner, the World Veterinary Association, to share their reflections and tips for success. Let's open this session with first a welcome from Shannon Mesenhowski, Senior Program Officer at the Gates Foundation.
Hi, everyone. My name is Shannon Mesenhowski, and I am a Senior Program Officer at the Gates Foundation, where I am a part of our agriculture development team, and then within that on our livestock pillar. And I'm the Program Officer that gets to work with this great team on the Veterinary Paraprofessional investment with FAO, World Vet Association, and Health for Animals. To start off the webinar, we thought it would be really valuable to just understand a little bit about why the foundation is partnering in this way and the importance that this work has on our overall vision for our investments. The foundation works by making investments or grants with partners. And in the livestock pillar, the focus of those grants and investments is to increase small-scale farmer incomes in pursuit of enabling economic mobility. So livestock and agricultural development are a part of an economic development strategy or approach or intention within the foundation. So the work that we do is always aiming at finding a way to improve productivity and production so that small-scale farmers can realize better income returns from their livestock assets. We know the foundation is a place that focuses on tools and technologies and innovations. And so we want to make sure that that approach within the livestock arena is helping scale up and discover technologies and innovations that meet the needs of farmers in the geographies where we work most, sub-Saharan Africa and South Asia. Some of the technologies and innovations that we tend to focus on in the animal health realm are vaccines, biologics, therapeutics. We also work things in the genetic technology space like sex-sorted semen or genetic and genomic improvement, and also do some work investments in sort of climate mitigation technologies. Again, always searching for those that are relevant and appropriate for farmers to want to take up in sub-Saharan Africa and South Asia. The big caveat that we know is that small-scale livestock farmer access to the information, technology, and tools that we're hoping to help improve production and productivity through is not always great. That comes in large part to a difficulty in reaching them with animal health services. That last mile delivery piece of animal health service and products can be really tricky. Historically, these services were a public sector good, and extension and outreach programs were the ones that were charged with reaching the small-scale farmers, the rural communities. That changed with the structural adjustment programs that laid down the vision that private sector could really fill that gap. It has not come to complete fruition, and small-scale farmers, unfortunately, are the ones that are being missed with those products, services, and tools. So the low number of vets that tend to reach the rural areas where there's the greatest number of livestock leave small-scale farmers without the right access to those important inputs. Our aim with this investment and some others is to really figure out how to address the gap in animal health service delivery that will help the innovation technology investments that we're working on really come to fruition. So this investment was really intentional in its design. It was a collaboration built between FAO, the World Vet Association, and Health for Animals to be a true public-private partnership that was focused on implementation. And along with that public-private partnership between sort of the private entities that Health for Animals represents and the public entities that FAO engages with, bringing in the World Vet Association to really ensure that the veterinary paraprofessional communication channel was intentionally built into the investment. We know that it takes a team to provide the level of service that small-scale farmers need, and so wanting to continue to build that bridge through the collaboration here. So today, we're going to hear how the model that I'm describing was piloted in the 3 countries that were selected: Nigeria, South Africa, and Uganda, some of the important lessons that have been learned over the initial implementation phase, and hopefully touch on or get a chance to hear about some of the really great impacts that have already started to pile up. This investment has been viewed as really successful, both in the intentionality of its design, its ability to adapt and iterate as sort of unforeseen things kept popping up during its implementation phase. And so I'm really excited for everyone to get to hear about the great work that this collaboration has put forward. Thank you so much.
Now I'd like to introduce Holly Hufnagel from the FAO Animal Production and Health Division and the Veterinary Paraprofessionals Project Coordinator. Over to you, Holly.
Thank you, Joanna. Hello, everybody. Thank you very much for joining the webinar today. I'd like to kick off by giving you a bit of an overview of the work that we've been doing regarding strengthening private sector veterinary paraprofessionals. And then my colleagues afterwards will share the specific lessons learned that have also been summarised in lessons learned publications, which we've recently released. You can go to the next slide, please. Great. So Shannon introduced the problem that there is with regarding a gap in access to animal health services and how veterinary paraprofessionals can be key in addressing this gap. I'd like to start off by clarifying who are veterinary paraprofessionals. They're not the same as community animal health workers. Typically, they have a technician level training in animal health. Depending on the country, that can be from a 2-year certificate to a diploma or a 3-year degree. Across sub-Saharan Africa, they're present in much higher numbers than vets. We calculated this and found they outnumber them at 10 to 1, and it's even higher ratio in rural areas. So they're much closer to the farmers and can really be their first point of contact. However, many of them work in the private sector and they face many challenges with regards to gaps in initial training, lack of opportunities for further training, despite working in very rural, remote environments with little support or mentorship or guidance. And with regards to gaps in the regulation of the animal health sector, they have competition with veterinarians and also competition with unqualified persons providing services, typically called quacks, or also with, black market provision of drugs. And so it's very difficult for them to sustain a sustainable business in providing animal health services. And if we can go next, this further kind of widens the gap in animal health service delivery. So next, our kind of mantra is how can we address this problem to decrease this gap in animal health services by mobilising the existing veterinary paraprofessionals, but helping them stay in their roles and in their businesses and really upscale their service provision and improve the quality. So overall, we've been focused on developing a sustainable business model for preventive animal healthcare services. And we've been working the past 3 years in Nigeria, South Africa, and Uganda to do this so as a real pilot to test this model. We've got 3 broad pillars of activities. The first is on competency recognition, the second on continuous professional development, and the third on the development of a supportive business environment. And next, I can take us quickly through each pillar. With regards to competency recognition, we've supported the development of country-specific competency frameworks for animal health veterinary paraprofessionals. And this has been a collaborative process through a series of workshops led by the veterinary statutory bodies, but bringing on board the veterinary associations, veterinary paraprofessionals, farmers, members from the public and private sector. And through this, we've taken the WOA competency guidelines, but tailored them to the specificities of the countries, the legal scope of work of veterinary paraprofessionals, and also updating them to include additional skills such as business skills, ICT, gender, and One Health. Next. And once we had these competency frameworks under our belt, we have moved on to implement trainings. And this is not initial training for veterinary paraprofessionals, it's continuing professional development, with really the objective to support thriving and sustainable private sector veterinary paraprofessional businesses that are centred around providing preventive livestock healthcare services. And we've had online learning components, practical workshops, and mentoring. And the lessons learned that we'll present today are very much focused on this pillar of work. And next, the third pillar of work is on the development of a supportive business environment. And here in each country, we've really sought to bring together the public and the private sector through the establishment of multi-stakeholder platforms. And the aim is for them to identify what are the key bottlenecks in the provision of private sector animal health service delivery, and how can these be addressed, and come up with homegrown, solutions to these. And it's also been an incubator for individual public-private partnerships that have been established between private sector animal health companies and the veterinary paraprofessionals we've upskilled, or between the public sector for implementations of surveillance or vaccination campaigns. We've also used it for developing, for example, radio campaigns to farmers to also strengthen the linkages between farmers and veterinary paraprofessionals. Next. So we also conducted a detailed impact assessment of what's happened to the veterinary paraprofessionals that we've trained. And we found from this that there has been a real kind of knock-on impact onto their businesses. 94% of the VPPs said that the number of referrals has increased. The number of clients served per VPP has doubled. And they've got a better access to reliable drugs and vaccines. And most interestingly, this is across Uganda and Nigeria. The incomes of the veterinary paraprofessionals have increased by 53%. And this little graph on the bottom shows you disaggregated women VPPs versus male VPPs and kind of the average income increase. And we've managed to slightly close the gap between women and men, where men were earning originally significantly more than women. And if we look on the next slide, we've looked at the impact at the farming level. So this is very recent data from a survey that we conducted in Uganda, where we interviewed farmers that had received services from our upskilled VPPs. And we asked questions on had they received advice on vaccination, on prevention of disease, such as biosecurity, or advice on parasite control. And you see very high levels reported there of 87%, 84%. But what's even more interesting is that many have gone on to change how they manage their farm and have adopted the advice. And here we can see on the right-hand side is the different measures that they've introduced with regards to preventing disease on entering their farm. And the left-hand side is the men farmers, and on the right it's the female farmers. And of these, for example, the biosecurity measures, 95% of the interviewed farmers reported that they felt these measures were effective. And across the board, 93% said they were more satisfied with VPP services compared to a year ago, and 83% felt that their farms were doing better. So with this data that we've collected, we're encouraged that this pilot model is having an impact. And we now today would like to share some of the lessons learned from the model. And if we could go to the next slide. And we've released 4 publications recently, one on our needs assessment, on our training program, our mentorship program, and on gender. And we'll share some of these insights today, but you're also very welcome to download these lessons learned papers to look at them in more depth, or to add additional questions in the chat today. And I'd like to now hand over to my colleagues, Jenny Maud, who's our veterinary education specialist, and to Nafinatu Abdullahi, who is our Nigeria country coordinator, to present the findings from the training needs assessment.
Thank you very much, Holly, for the introduction. Next slide, please. Right back at the beginning, it seems like quite a long time ago now. Before we started doing our training, we needed to design our training program, and that was based on quite a comprehensive needs assessment. And so the first part of this presentation is really to present some of those results and what we learned from that. The needs assessment asks 3 key questions. First of all, what is the environment in which our VPPs are conducting their businesses? Which competencies do we need to build for those VPPs to enable them to strengthen those businesses and provide better preventive healthcare services to farmers? And then once we knew those, how are they best going to learn those competencies? To find this out, we took a mixed methods approach. So we did some desk research, we conducted focus group discussions with VPPs, with farmers and with vets. We conducted key informant interviews with key people who could advise us from government veterinary services, from training institutions, etc. And we did a quantitative survey of the VPPs, contacting them by telephone rather than online, because we didn't want to bias our results, and disaggregating that by gender. And we conducted this in all 3 of the project countries. Next slide, please. We're just giving a few of the results today. We don't have time for everything, but one of the key things to do with the business environment is the regulatory framework. The first thing we looked at was what's the legislation in all 3 countries. There's considerable variability, as you can see here, and it's also something that's in constant development, and I can say developing and improving rapidly. You can see, for example, when we started our project in South Africa, we have very clear scope of work, very well-regulated primary training for VPPs. But when we started, VPPs were not allowed to work in the private sector. That has since completely changed, and VPPs are now allowed to work in the private sector. In contrast, for example, in Uganda, VPPs are allowed to work in the private sector. They're starting to be registered under the veterinary statutory body. When we began, not all of the primary training institutions were recognised, and I'm pleased to say that since that point, new legislation has come through in Uganda, and further primary training institutions are now recognised for proper registration of VPPs. Next slide. We then we tried to find out this question about what are the priority competencies we'd like to build. And we did that in several different ways. We mapped the primary training curriculum at the Primary Training Institute for the VPPs. We also asked VPPs, both in the quantitative survey, and both VPPs, vets and farmers in the focus group discussions, which competencies they thought that VPPs needed to build. And you can see here there's a very oversimplified version of a matrix that we made as a result. And you can see that it's interesting that not everybody agrees. And sometimes we would, for example, find gaps in curricula, for example, in business skills and gender, and perhaps BPPs or livestock keepers weren't demanding that those skills would be built, but we knew it was a significant gap. But on the other hand, there were areas where everybody agreed. For example, everybody agreed that they'd like to see increased competencies in herd health planning. And I'm now going to pass over to Nafinatu, who will talk more about some of the needs assessment results.
All right, and thank you, Jenny. So in our efforts to comprehend the VPP work environment through the needs assessment we conducted, we have identified both challenges and opportunities that exist within the business landscape, VPP business landscape. I had the privilege of leading the needs assessment in Nigeria, so I'll be sharing some field experiences while highlighting the challenges. Firstly, one of the most significant findings was the rivalry between veterinarians and VPPs, particularly in Oyo, one of the pilot states in Nigeria. This rivalry was so pronounced at the time that veterinarians were shutting down the drugstores operated by VPPs, ostensibly due to legislative issues. There are also issues around competition with quacks, as Holly mentioned earlier. Unfortunately, farmers often struggle to identify professional service providers, which leads me to the next point: lack of recognition for VPPs and the reluctance of farmers to pay for their services. Another challenge is the scarcity of vaccines and the difficulties in maintaining cold chain, which are exacerbated by unstable electricity, the prevalence of poor quality and counterfeit drugs poses a significant challenge as well. The majority of drugstores operate and managed by individuals. To the issues I just mentioned, veterinary drugs are frequently sold in open marketplaces without proper storage, exposing them to extreme temperatures and sunlight. It was also reported that products manufactured in certain countries tend to be of inferior quality and less effective, while reputable products are often expensive. Next is the limited number of diagnostic labs, which further compromises the quality of VPP service. Then insecurity, including incidents of kidnapping, banditry, significantly hampers service delivery and limits farmers' outreach. Lastly, there are notable gaps in transportation that affect the overall efficiency of service provision. So now turning to business opportunities, three major ones stand out. One is proximity to farmers. VPPs and community animal health workers serve as the first point of contact. If farmers need any professional services, they are the set of people that they reach out to before vets. Then feed formulation and provision of nutritional advice proves to be lucrative. And of course, reproduction and artificial insemination services, since farmers are always eager to enhance their local breeds and also increase production. Next slide, please. Yeah, so at this point, I would like to present some noteworthy findings regarding gender that have significantly influenced our training design. I'll first discuss findings related to female farmers. The first point is the disparity in women's access to animal health services when compared to their male counterparts. In South Africa, as seen in this graph, only 33% of women farmers have had contact with an animal health practitioner in the past year, in contrast to 67%. So the gap is really wide. This finding aligns with data from FAO, which reported globally merely 5% of women receive agricultural extension services. Secondly, women often access information and training indirectly through male intermediaries. This is because the livestock service delivery systems is male-dominated, thereby creating barriers for women in accessing essential services. So having more female VPPs in practice or in the field would greatly improve women's farmers' access to services. Additionally, promoting a gender-responsive service delivery approach among male VPPs will further facilitate access to information. Another critical finding is that women's limited ownership and control over land often confines them to managing small livestock, such as poultry, pigs, and goats, which are primarily raised in their backyards. In contrast, men are more likely to raise larger livestock that are commercially valuable. So it is crucial that trainings covers these smaller species to effectively address the specific needs of women farmers. Next slide, please. So what are our gender findings regarding VPPs? Our focus group discussions have illuminated strong gender bias among farmers towards female VPPs. Negative stereotypes that suggest women are less capable of delivering services effectively, lower remuneration for providing the same services as their male counterparts. Lack of adequate animal handling facility poses significant challenges, particularly when it comes to restraining large animals during clinical examination or treatment. Then sexual harassment from male farmers. Transportation also presents a considerable obstacle for women. Like in certain communities, it is socially unacceptable for women to ride motorbikes. Then, in addition, gender norms can act as barriers. For instance, in South Africa, women are prohibited from entering kraal or handling animals during menstruation, as it is believed that this may result in death or illness for the animal. So consequently, all these challenges often lead to lack of confidence among women, and to address them, there's a need need to enhance women's confidence, particularly by focusing on communication skills in the areas of setting prices and the escalating situations of harassment. It is also essential to develop models of gender allies, wherein a male and a female VPP collaborate, thereby ensuring a safer working environment and build trust within the communities. Finally, it is important to incorporate animal handling in trainings. Next slide, please. We have also gathered data regarding different training modalities and learning preferences for VPPs. And I would like to present our findings and considerations that helped design a suitable training model for our project. These findings have been further disaggregated by gender. So to begin with internet access, the gender disparity is relatively narrow, as illustrated in the first graph. The percentage gap is 24% in Nigeria, 19% in Uganda, and only 2% in South Africa. In terms of access to technology, smartphone ownership is generally high compared to computer laptop. When disaggregated by gender, it is evident that men tend to have a higher ownership of laptop as depicted in the second paragraph, which is in the second graph, which is consistent across all 3 countries. On smartphone ownership, it appears to be equitable between genders, as seen in the last graph, also consistent across all 3 countries. So this suggests that online training content should be smartphone compatible to enhance accessibility. Next is the preference for face-to-face training, but it is important to consider that VPP entrepreneurs may be unable to forego income to attend long sessions, and women often bear additional responsibilities at home. Therefore, it is advisable that face-to-face training sessions be kept concise to promote good attendance. Lastly, due to flexibility of online learning, peri-urban VPPs have shown greater interest. So in conclusion, and based on these findings, a blended training model will be a commendable approach. I shall pause now and we'll be happy to take questions on the presentations made so far. Thank you.
Thank you so much, Nafinatu. Really impressive to see some really nice tangible results. I wanted to go to Mafalacha Kutu, you've got your hand up. So do you want to speak to your comment? I'm not sure if you're able to unmute. But if not, we have a comment from the chat, and I think this is probably for Jenny, saying that there's still challenges as most pharmaceuticals are not keen to work with animal health technicians under their own account, and they still send them to co-ops, and that makes it unsustainable as a business. So Jenny, do you want to comment about where the VPPs in this project source their pharmaceutical products, or about anything to do with the relationship between VPPs and pharmaceutical agents?
Thank you. So it's a very important point, and I think some of my colleagues may comment as well. I think the person commenting may specifically have been referring to South Africa, where we have a situation where VPPs working in the private sector is very new, and therefore having more established supply chains for pharmaceuticals is definitely one of the current challenges they're facing, and that's a valuable comment. But I think that challenge extends to all 3 countries. And although today we're speaking a lot about training, it's important to mention that the project hasn't only included training, it's also focused on setting up multi-stakeholder platforms that look at all these aspects of the business environment for VPPs, and particularly how we can link them to better sources of inputs that they can then sell on to farmers, so they can source them better. But most importantly for us is also high quality pharmaceuticals, because there is a real challenge with counterfeit medications, with maintaining a cold chain for vaccines, etc. And I suppose it's nice you ask me, because I'm always the one talking about training, but I'm usually the one who says, oh, it's not all about training. You can do the training, but you need all the other things to be working as well. And access to pharmaceuticals is definitely an important one of those. I don't know if any of my other colleagues would like to comment further on that.
Maybe if I could come in, I'd say specifically for South Africa, when there's a change of legislation, it takes time for these changes to cascade across all the stakeholders. And I think the South African Veterinary Council, who are actually also online today, have been doing quite a strong job in communicating this and trying to raise awareness, but it doesn't happen overnight. It takes a little while. And I think it also takes time for then the pharmaceutical companies to also then put things in place to maybe directly, supply products to animal health technicians. And that is something that we did as part of our training, is that we did bring them on board in South Africa. And some of the companies then said to our trainees, you can open direct accounts with us, which kind of helps cut out the middleman so they can get better prices for them. But it's still a process.
It's not easy having multiple players involved, because you need to have dialogue with each of them. And yeah, I feel like you've achieved a lot in just one project. But yes, I do think that is a common challenge across the board. There's also, I have a question actually for Nafinatu. The amount of bias against female VPPs in the community, and the gender norms that really constrain what people can and can't do. How long does it take for that to change, to kind of gain acceptance in the community? I imagine this is quite a long process, but you managed to do it within the time of your project.
Thank you, Johan, for that question. Recall we said we started implementing in 2023, and so far we have recorded many success, because like I mentioned earlier, our training, we try to encourage male VPPs to apply gender sensitive approach in delivering their services. And that seems to work quite well, because some of them, majority were able to report that they were able to improve their service delivery, and they were able to reach more farmers, especially if they pair up with a male or a female VPP working together. Building gender allies is really important, and will greatly increase outreach. And we have the multi-stakeholder platform, where we bring in different stakeholders, and they are also supporting in spreading this information that female VPPs are as good as the male VPPs, and will be able to provide the same level of services in terms of quality compared to their male counterparts. If that responds to your questions.
Yeah, that's great. Thank you. Thank you. We've got quite a number of questions rolling in the Q&A now, so let's go to some of those. The question from Pam Luca about how we manage the activities of VPPs, community animal health workers, and veterinarians in containing the spread of antimicrobial resistance. Is it just a legal framework, or is there an issue of training that comes in as well? And I think Nafinatu, do you want to answer that one as well?
Johan, please, can you come again? Because I missed yours.
So the question from Pam is about how VPPs, community animal health workers, and veterinarians can all work together to contain the spread of antimicrobial resistance, and how much of it is a legal framework issue and how much of it is a training issue.
Okay. Yeah. When it comes to collaboration, I think vets supervising VPPs and providing technical support is really important. VPPs often lack this mentorship and support from vets from our initial findings. But now this is improving, and because we are now linking them to pharmaceutical companies and people that are, vets who are, in terms of their technical capacity, are higher, they tend to get more support. And we also try to drive this mindset of preventive healthcare approach rather than curative treatment. So our training is focused on preventive healthcare uh, approach, so that VPPs tend to provide advisory services on best animal husbandry practices, so that their animals are kept healthy, just like the popular saying, prevention is better than cure. So that way, VPPs would limit the amount of antimicrobial they use on farms, and also translate that into farmers' behavior, because if they're able to reach out to more farmers to, adapt this best husbandry practices, then the use of antimicrobials will be drastically reduced.
Another multi-pronged approach needed for that. Thanks, Nafinatu. Jenny, I've got a question for you about what about the VPPs who don't have laptops? How do they access the training?
So relatively few VPPs have laptops. But the good news is that most VPPs have smartphones in the countries where we've worked. When we started our training program, I'd been working in online learning for a number of years, and myself and many others were very skeptical about whether or not online learning would work for VPPs. And I think you're going to hear a bit more about this in the next presentation, but we can say that it does. With some caveats. So I think learning how to use your phone to study online is not easy, and people need help with technology. Some of us are very good with technology, others of us are not, and those ones who are not need a bit of extra help. And my biggest message is that any kind of learning is not about the technology, it's about the people involved. And certainly we found that to have people studying well online, you need a community, and you need trainers and facilitators who are supporting them, and then you need a community of learners themselves who are talking to each other as they learn. And most of us have phones that now kind of buzz off the hook because we're in so many WhatsApp groups of all these different VPPs all talking to each other. There's never a quiet moment on my phone, and I think that's the same for everybody in the project. And that kind of simple, easy technology using phones has really enabled us to do an awful lot. But very few of them are on a laptop.
Must require a lot of dedication to do training modules off your mobile phone. So really nice to see that people are sticking to it and they're really driven to do it. I don't know if this is for you, Jenny, to continue on, or maybe back to Nafinatu, but does the age of the VPP influence the time that they want to do the training, or whether they participate online or hybrid or like in person?
Maybe I'll ask Nafi, who can comment on the VPPs in Nigeria.
Yeah, when it comes to age, what I would say is it affects women particularly, especially for women that are in their childbearing age. If they have children that they would take care of, and household responsibilities, that tends to affect them more. But in terms of generally age, the impact is not, the difference is not that much.
Okay, thank you.
Yeah.
if I could add a little bit more on that, that's okay.
Yeah, please go for it.
Just to say, like, it really varies many factors, like if they're urban or if they're rural, their age, but also, as Nafinatu said, the time of their life. Like those actually with young children often commended online training was easier for them because they could fit it around their family commitments better. Younger people did generally tend to be more tech savvy. Older generations found it a bit harder and needed more help in terms of how to get online. And the urban people were much more open or interested compared to rural. But there's a lot of variation. It's not a uniform group.
Great, thanks, Holly. I think that's the case all over the world. Yeah. Actually, Holly, while we've got you, can I ask you, what has been your experience with the VPP project driving farmer demand for VPP services? And we're getting close to the end of this Q&A session. So if you also want to answer Simon's question, which is about paraprofessional organizations developing, whether all the VPPs are independent or whether they organize themselves.
Okay. So with regards to driving farmer demand, this was an area we were a bit concerned about when we started the project. Will there be enough demand? And we therefore ran a radio campaign with Farm Radio International in all 3 countries to raise awareness among farmers on the value of preventive healthcare, and in particular on the value of getting animal health services from a qualified animal health service provider and not a quack. And we got positive feedback that the messages were trickling down to the farmers. But where I think we've had the biggest impact is actually as part of our training for veterinary paraprofessionals, and we'll cover this later, but we've linked marketing as part of the business skills. And the main message we've had for marketing is training. So go out to the communities, run awareness raising campaigns to farmers on the value of preventive healthcare and on the value of your services. And as you do that, you'll create demand. And, the feedback we've had is amazing. And, they've doubled the number of farmers that they serve. So clearly that really does work. And I think it's that direct community engagement, which is the right way. And then the second question on the associations. Sorry, Joe. Yeah. So what we haven't presented today, we've tried to be brief because we don't have much time to cover everything. But prior to starting in each country, we did a proper analysis of the legal framework, of the stakeholders, stakeholder mapping. And in the 3 countries where we're working, there are veterinary paraprofessional associations, which represent the VPPs. And in Africa, there's also the African Veterinary Technician Association, which represents veterinary paraprofessionals. So each country has their own organizations. Some of them have individual chapters, either regional or kind of women representatives. At the moment, our understanding is a lot of them represent public sector veterinary paraprofessionals. They do also have private on board. It depends on the country, but the engagement from the private sector is less strong, and that's something which might be strengthened going forwards.
And just to add to what Holly mentioned about farmers' demand, we also have farmers' association and cooperatives that are part of our multi-stakeholder platform, and who have also been helping in creating awareness about the upskill VPPs and their business model.
Okay. Thank you, Nafinatu. I think now we can wrap up this Q&A session. We've got another Q&A session afterwards, so please do keep adding your questions in the chat. And I'd like to hand over now to my colleague, Afolarin Bolaji, who's our training lead in Nigeria, who can actually share some insights from the implementation of the training.
All right, thank you, Holly, for the introduction. I want to say hello to everyone. I'll be discussing the training model that we used majorly in Uganda and Nigeria, where we have similar training model. And it's important for us to know that it's a blended one because of the result of the need assessment that was just shared a few minutes ago by my colleagues. The focus of the training is actually to support the VPP to change from the firefighter business model or approach of just going there to inject sick animals and to that of developing a thriving and sustainable private sector VPP business that provides preventive livestock healthcare service. And ultimately, at the end of the day, it's aimed to be a win-win situation where the VPP business grows better, and also the farmers' livestock business also grow a lot better. Can we move next to the next slide, please? So these are the topics area where we have both that we were able to cover in both the business skills and the preventive health care, and just for us to have a light of what they were able to learn from the face-to-face workshop and the online modules that was shared on. I can move to the next slide, please. Yeah. So from the structure overview of the whole training model, it's such a one that we had during the first workshop. VPPs were taught. We have like a kind of a first workshop, like an introductory workshop, where everybody got familiarized to what the whole project is all about, the whole training is all about, and it was designed in such a way to fit around VPP's business and family commitment. So the first workshop brings together everybody, and after the first workshop, we had 3 chunks of online learning, which took place for 6 weeks in each of those online online unit. And after the 6 weeks, we have a face-to-face workshop, which is also followed by another set of online learning. So 3 chunks of online learning, and we had a 4 face-to-face workshop at the end of the day. So we'll move to what we did in the online learning aspect component of the training. Next slide. During the first workshop, the VPPs were taught how to get online, and that we're able to onboard them into the FAO Virtual Learning Center platform. It's also important to let us know that this platform, many of them are using it for the first time, and because of that, there's a need to guide them to be able to know how to navigate the platform. The platform is smartphone compatible. A lot of questions was raised in the last session about if they had access to laptops and all of that, and it was very, very important. It's very important to let you know that they can actually access the online modules using their smartphones, which is optimized for low bandwidth use, which means they can always work offline, and whenever they come online, they can always upload the result, and they get the work done. Also, the online modules are very, very interactive. There are a lot of quizzes, videos, discussion forums where they can share their experiences, what they've learned, what they were able to discover, during the learning process. They had time to do assignment that requires them to go to the field and do one of things or to other. There are also webinars and also WhatsApp communities where they can share with colleagues from other countries, especially their counterpart VPPs in African countries. Next slide, please. The face-to-face. Now, going to the face-to-face workshops, it's one that they had a practical hands-on application of what they were being able to do in the online learning. So during the face-to-face workshop, they're able to go to the training institute farms. They also visit local farms to be able to animate those things that they've been able to learn online. They had interactive classroom sections. There's one of the things they did is there was this role play activities, discussions, and to be able to imagine what the real life situation would be. And this was very, very, very important. Also, the face-to-face workshop was implemented through through a partnership approach with the local training institute for sustainability, because we know that at some point in time, the FAO is going to exit this program, and there's a need for sustainability. There's a need for these training institutions to be able to carry on with these trainees. And so we had to partner with a local training institution to be able to deliver this content. Next slide, please. So looking at what we call the gender considerations and modalities and the content of this training, it's very, very important for us to know that we took into consideration to the training to address these challenges, especially by allowing flexible, self-paced learning. They can always determine, okay, when do I want to complete this module, and work at their own convenient time to be able to meet up. And it's also important for us to know that in us deciding the selection process, we were particular to make sure that we have 40% of women being enrolled as VPPs that went through this training. Also, we had to make sure that the face-to-face workshop was short and not more than 3 days, so that they will be able to, attend to family commitment and even to their business. During the face-to-face workshop, we also made sure that the training institute provided child-friendly training facilities so that nursing mothers will be able to come to the training with the babies, and the babies were taken care of. At the point of inception, they were given what we call the family welcome packages. This will enable them to share with the family and to be able to prepare their mind. Maybe they need to change roles and all of that to ensure that they are able to participate in all of this training. Also, it's also important to let you know that we focused on topics that women prioritized, especially animal handling, to be able to build their confidence. Before the training, a lot of female VPPs could not handle large animals, do not have the confidence to do so. But after the training, they were able to, now handle large animals and be able to attend them, of course, improve their income at the end of the day. There was also strong focus on communication skills, including how to set and negotiate prices, strategies to de-escalate situation of harassment, and also all the VPPs were trained on gender-responsive approach. My colleagues shared the whole time. Many of them now, when they need to go to certain places that is gender sensitive, they collaborate with counterpart VPPs to be able to provide that service and share profit. It's also important to let you know that we'll be hosting a separate event under the SEBI Gender Community of Practice to share our gender lessons that we learn in more details, which will be in the chat box, and other related publications will also be shared in the chat box. Next slide, please. So the feedback that we're able to get and the impact that we're able to record. Next slide, please. From this training is that from training partners, the partner training institute were able to highlight how the collaboration, had strengthened their institute. Part of the training content and materials were now adapted to their pre-existing undergraduate courses, which is something that we are so proud of. So many new things that they were able to gain from this training, they were able to translate it even into their pre-existing undergraduate courses. Also, there's long-lasting ties between trainers, trainees, and mentors. Improved VPP relationship. My colleague also noted the other time that this rivalry, but now little by little, the story is changing. Things are getting better as regarding that. The next slide, please. Speaking of the lesson learned on the online learning as the suitability, it's something Jenny was saying the other time that at the beginning it was something of a concern how VPPs will be able to, do well in the online aspect, and which was so interesting to see that at the end of the day we had 98% completion rate despite this 8-month duration, and there are no financial incentive provision during this time, except for the incentives given to them in terms of for data provision, so that they can able to come online. So online learning works well. And for the VPP training, we had 4.45 over 5 satisfaction rate in survey. VPPs also praised being able to learn from peers in other African countries through the community of practice, which is something that we are so glad about. Can you go to the next slide, please? So the need assessment, next slide, please. The need assessment, because at the end of the day, this is a recommendation, the need assessment was crucial to the training design process and to identify appropriate training content and modalities for the target group. So it's important that at the beginning there's a need training assessment to be able to really know what exactly is needed to be done. Also, the blended training models are most effective, if most cost-effective way of working with VPPs from our findings. Live webinars are particularly challenging because to attend, because they require higher bandwidth, which is one of the low point. Highly important to also maintain what we call practical aspect, but this should be kept short when training with working professionals, especially women that have to attend to family commitment and all of that, so that they are not kept away from their business and families for too long. It's also important for us to strengthen our training institute partner in IT skills from what we were able to get. And it is also critical to ensure that they can support the delivery of webinars and promote general IT advice, because one of the things we're able to do in our live webinars, live course, the training institutes were also part of it, deliver lectures. So it's all, they were carried along all through the process, so that at the exit they were able to carry along and without the fear of the project not be able to continue. I think at this time I will hand over to Sylvia, a colleague of mine, to give us more perspective from the mentorship aspect of the program. Over to you, Sylvia.
Yeah, thank you so much, Bolaji, and all colleagues who have come ahead of me. I am glad to share something about our mentorship model that supported our VPP trainees. Let's move to the next slide. Yeah, we identified appropriate mentors for the VPP trainees through a competitive call where the experienced VPPs and veterinarians who are interested in mentoring the trainees applied, expressing their interest. They were selected, and then we went through a whole process, building their capacity, matching them, and then supporting them to do the mentoring, and then also facilitating the feedback process. We can move to the next slide, please. Yeah, as I said, the mentors who were identified were already people with experience who are practicing, providing services to the farmers. But still, after they joined the program, they went through a sort of a mentorship capacity building process where they participated in a 1-month blended training involving an opening webinar and also going through online modules, which was self-paced. There were 8 of those self-study online modules. And then at the climax of the training for mentors, we had a workshop, a 1-day face-to-face workshop. And it was after this 1-day face-to-face workshop when we brought the mentors and the mentees together in a physical meeting, and where we initiated now the process of mentoring. Let's move to the next slide, please. So the process, the mentoring process involved the initial face-to-face introduction or introductory meeting. And then they went through a self-assessment where the mentor was able to find out from the VPP mentee that was assigned to them. They were able to sit down and have a discussion and find out their business and personal development priorities or interests. And at the start of the mentoring process, then they had their first mentoring session, which were followed up by the monthly meetings, where the mentor was able to check on the mentee on monthly basis to check on their progress. We can move to the next slide, please. We have some overall feedback that we'd like to share from the VPPs, who are the mentees, and also from the mentors. Overall, the VPPs indicated a very strong overall satisfaction with the mentoring process, and all the VPPs that were surveyed from Uganda and Nigeria, they merited a mentorship program, and they actually wished that it could continue beyond the project period. I would also like to indicate, highlight that the mentorship mainly took place through telephone, through WhatsApp. Mentors in the same geographical areas. The other feedback we received, the VPPs indicated that they were able to start new partnerships. They were able to establish new partnerships. They were able to tap into new opportunities. For instance, additional training in artificial insemination. They were able to start providing artificial insemination services. They gained client referrals through the mentors. And by so doing, they were able to expand their professional networks. I would also, of course, they received regular support through the bi-weekly calls, bi-weekly calls, and all this contributed to the effective training of the PVPs during the first.
Hello, Sylvia. We might have some tech issues. Connectivity is always an issue. Holly, are you able to take over from Sylvia? I think we've just
I'm sorry, I didn't. I didn't warn you that we are into the second phase of the training, and right now I'm in the field on one of the training farms, and internet connectivity is not very good, but thankfully we are coming towards the end. Let me have the next slide, please. Yeah, let's also look at feedback from the mentors side. According to the mentors appreciated this opportunity, although it was voluntary. There was no compensation for the mentors for this great role that they played, but they did appreciate being able to impact people into the profession, most likely the young practitioners. They were able to build relationships with their mentees, and overall, the mentorship program did contribute to improving the good relationships between veterinarians and veterinary paraprofessionals, and turning them into collaborators rather than competitors, as we heard from Nafinatu. During the needs assessment, many veterinarians and VPPs, they related more competitors than collaborators, although according to the laws of the countries, the project countries, veterinarians were expected to supervise the VPPs. So overall, that made a great contribution to improving that relationship. The mentors or veterinarians and VPPs, they improved their general knowledge and professionalism. They also gained mentorship skills. Some of them had never deliberately mentored, and this was their first opportunity to participate in mentoring, which was guided, which was supported, and also was supervised. And of course, they went through the training, which also contributed to their own personal professional development. And above all, it was satisfying for them to see the mentees venturing, becoming better entrepreneurs, establishing businesses that did not exist before the project. And also, they were able to see feedback during their support to the mentees, and all this was very encouraging. Next slide, please. Here we just showing or showcasing two examples of mentee-mentor relationships. Here we have a mentor. Sorry, we have a mentor over here, and we have a mentee, a female VPP who was able to establish a veterinary drug shop and use it as a basis for providing animal health services to the farmers, which was not in existence previously. And here is a supportive mentor, and here we also have a mentee and a supportive mentor who have told us that even after the project, after the training, they are still continuing their relationship of mentor-mentee, and the mentee is very appreciative. As we come towards the end, we can look at a few lessons learned based on what we gathered from the mentors and mentees. On this slide, I want to highlight about two things only. Physical face-to-face meetings between the mentors and mentees were very helpful, although much of the mentorship did not happen physically, thanks to COVID-19 partly, but also we did not have a budget that facilitated them to meet physically. But the initial physical meeting had value and was very important for the building of those relationships. The other aspect that I wanted to highlight before I submit is that mentorship worked better for mentors and mentees who were operating within the same geographical location. Distance seemed to be a barrier to effective mentorship. And then lastly, private sector mentors, mentoring private sector VPPs also had value, which contributed towards making the mentorship effective, but also towards an overall effective CPD training program for VPPs in Uganda, Nigeria, and South Africa. I would like to thank you for your kind attention and apologies about the network challenges. I thank you.
Thank you, Sylvia. And at this stage, we'd just like to say that this was a real team effort, and we'd like to acknowledge the contributions from all the partners of this project, in particular the training institutes that we worked with, the veterinary statutory bodies of each country. And I also see we have online today some of the trainers, some of the mentors who really were key in this programme, also the veterinary associations and the veterinary paraprofessional associations. Every stakeholder had a real part to play. And as Shannon mentioned at the beginning, this programme was a collaboration with the World Veterinary Association and Health for Animals. And so now, before we move on to the final question and answer session, we'd just like to hand over to the president of the World Veterinary Association, who has recorded an address to share with everybody here today.
Ladies and gentlemen, colleagues and partners of this very successful project, Strengthening Private Sector Veterinary Paraprofessionals. My name is Dr. John DeYoung, and as president of the World Veterinary Association, it is my pleasure to address you in this webinar. The lessons discussed and learned today provide valuable insights and best practices in offering practical guidance for improving the training, delivery, mentorship, and business development of veterinary paraprofessionals, ensuring that they can offer high-quality services and contribute to resilient livestock production systems. The mentorship scheme was particularly successful where private sector mentors were selected. A flexible approach proved to be better, and monitoring was considered to be an important part of the scheme. It was shown that female veterinary paraprofessionals and animal health technicians had more challenges when compared to their male counterparts. In some geographic areas, female VPPs were not permitted to visit a case on the farm. And if they were not allowed to actually enter certain areas for traditional reasons. Remuneration was also less when compared to men, as was access to the internet. Safety-related issues also were raised, such as sexual harassment by farmers. Veterinary paraprofessionals, both male and female, play a crucial role in animal health delivery systems. Projects like this play a critical role in addressing and assessing it. For future steps, and when considering new or unemployed trainees, it is good to carefully select the locations where they are going to before the training starts, and to select people from their own communities to ensure retention and appropriate service to the livestock population. The World Veterinary Association Congress, to be held in Washington, D.C. this July, under the theme United for the Veterinary Community, will emphasize the need to all work together in the providing of animal health care. I welcome you all to attend and to share more lessons learned from this project. Thank you.
Thank you, everyone. Thank you to all the presenters, and thank you to the World Veterinary Association for the video as well. We have a little bit of time now to answer a few more questions, and so there's been a question in the Q&A from Xiomara Chavez about whether VPPs also participate in mentoring community animal health workers. Bolaji, do you want to tackle that one?
Yeah, thank you, Johan. I think it's interesting to let us know that in the first phase, we had the vet providing mentorship to the VPPs. And one of the things that we have also improved on going to the second phase is to be able to now see if we are able to find VPPs that are experienced enough to start providing mentorship which will foster, a lot of collaboration between VPPs, even to their fellow VPPs, just a more experienced VPP. So we definitely, to answer the question, we can have VPPs providing mentorship to community animal health workers. Just to let you know, it's not just vets that is providing mentorship, but also VPPs that are experienced, gone through the process, especially this kind of training, are also able to provide mentorship as we have it even in this second phase. Thank you.
Thanks, Bolaji. There's quite a few questions about AMR in the chat, but there's a specific one from Keith about. Oh, yes. Hi, Sylvia.
I wanted to provide an additional response
Please
to the
do.
question that Bolaji has just addressed. Of course, in reality, I am aware in Uganda and probably in Nigeria that VPPs have a lot of experience and expertise, and they do provide mentorship to other cadres of in the profession, besides just providing the services. And actually, during the last training in Uganda, some of the mentors were experienced VPPs. Well-known VPPs were experienced, who also operate private businesses. They were listed among our mentors in Uganda. It wasn't only veterinarians. So that means they can actually mentor community animal health workers. However, community animal health workers were not considered under the scope of this project. The focus was only VPPs. So we didn't really assess, either during the surveys or needs assessment, we didn't really indulge with the community animal health workers, or we didn't try to assess what happens between VPPs and community animal health workers. But I'm sure if we did, we would find. And personally, I know that well because I served on the advisory board, the regional board under Farm Africa, where we were working with the Community Animal Health Network, and I definitely witnessed VPPs providing mentorship. I thank you.
Thank you, Sylvia.
Sorry, Johan. Sorry.
That's fine, Nafinatu.
Yeah, I just want to add again to the issue of VPPs mentoring. I recall you did mention the impact we made in terms of bridging gender gaps. And one interesting example is one of our VPPs in Kaduna called Queen. She initially started like any other female VPP with troubles setting up her business. Already she has a business, but then it was not thriving well. As we speak now, she has been awarded like a female community leader, and one of the farmers association, or will I say is a community of farmers, also have awarded her with a title, a traditional title, because they now have trust in her and actually recommending her to other farmers. And again, they these farmers are majorly people that keep cattle, large animals. And before now, she was focused on just providing services to farmers who raise small livestock and pets. So this is one of the examples that I think is worth sharing. And now she is mentoring other VPPs in this cohort. Thank you.
Thanks, Nafinatu. It's really nice to hear some stories around the change for community animal health workers as well. I'm actually just going to change tack. I wanted to ask Jenny about whether this course is accredited or certified.
So that's a very important part of our model. So the course, in all 3 countries, the veterinary statutory bodies now have a programme of accreditation of continuing professional development. And we have accredited our courses for continuing professional development in all 3 countries. This is very, very important because we've had sustainability at the forefront of our minds the whole way through this project. For CPD for VPPs to be sustainable in the long term, there needs to be a whole ecosystem around promoting the need to do CPD. We need, and one of those key things is it needs to be a requirement for registration. So in both Uganda and Nigeria, the process of registering all the VPPs is still ongoing. It's only not very long that there's been a requirement to register them under the veterinary statutory body, but through the project we've managed to really build this impetus. Firstly, VPPs, you need to get registered, and secondly, you get registered, and then this is your meeting your CPD requirement. And I think that's area of building the capacity of local providers of CPD so that in future we have a whole ecosystem providing and encouraging CPD in a country is where we dream of seeing for the future for both vets and VPPs.
Thanks, Jenny. Lots of engagement in the Q&A. Unfortunately, we only had time for maybe 2 more questions. So I'm going to ask Holly. There's a question from Keith about preventing AMR with greater access to vaccines. And there's also a question about cost benefit of the VPP approach. Do you want to quickly answer those 2 questions and then we'll move on? Thanks.
Thank you. I think I can tackle them jointly. In terms of cost benefit analysis, I can tell you what we have done is we've wanted to look at the impact of the veterinary paraprofessionals on them who've taken this training. And we've used the livelihoods framework approach for that to be more holistic. So we've looked at how has their social capital increased in terms of their networks. Are they registered with the veterinary statutory body? We've got a number of proxies. Their human capital in terms of their competency skills and their confidence. Their physical capital in terms of have they got better infrastructure now for their business, and their financial capital in terms of their incomes. And that's where we found in Uganda and Nigeria, 1 year post-training, when we did the survey, their incomes had increased by 53%. So we have, an understanding of the impact on the VPP businesses. And then what we wanted to do is cascade down and see what's the impact on the farmers that are served by those VPPs. And we've had many debates on how to assess this impact and initially wanting to quantify it, but we're aware that there are so many other things that, affect this impact. So what we decided to do was look at the knowledge, attitudes and practice on farm level. So is the information that we're giving to the VPPs being cascaded to the farmers? Do the farmers have knowledge on that? And what's more important is, are they then changing their behaviours and their practices? And we've only just started this assessment. We did it last month in Uganda, and we're going to be running next month now in Nigeria. But the results are very encouraging, and that comes down to the vaccination question. And I just wanted to share my screen to share one slide, if possible. And this shows you in Uganda our results when we asked the farmers, did you vaccinate in the past against this disease? Or do you vaccinate against this disease, yes or no? And then when they answered yes, we asked, well, have you vaccinated in the past, or was this year the first year you vaccinated in this disease? And the results in poultry are quite striking. In green was last year. So since the VPP has been trained and upskilled, they've now vaccinated against that disease. And so we've had an uptake of 84% for Newcastle disease, 62%, for example, for fowl pox in poultry. And this really shows, only 7.8%, 13.7% were vaccinating before against these diseases. So I think there is a real kind of chain in terms of impact here. What I must say is we need to caution for some diseases like FMD. There was a big outbreak last year in Uganda, and it was a government-sponsored campaign, but which our VPPs were involved in supporting. So not all of them is down to the farmer themselves actually paying for those vaccines. But we've got further questions that we've asked. Who administered the vaccine? Was it yourself or was it the VPP? And who paid for it? But this is, a body of data now which is showing that farmers are more willing to vaccinate when they have good quality service providers that are providing them advice on that. And they are willing to invest and pay into that. And that's really encouraging for antimicrobial resistance, because it's this switch to preventive healthcare which is going to make a big difference. I think we have to wrap up now. I don't think there's any more time, is there, Jo, for more questions?
No, sorry.
But we'd like to hand over now. We're very lucky to have with us Dr. Ndudane, who is 2 hats here. She's the Africa Councillor for the World Veterinary Association, and also actually 3 hats. The president of the South African Veterinary Council has played a really leading role in supporting veterinary paraprofessionals to be able to work in the private sector in South Africa, and also happens to have been leading one of the training institutes that we've worked with, Solo Tadi. So I'd just like to hand over to you to wrap up some of the thoughts from the discussions that we've had today.
Thank you, Holly, and good afternoon. In my time is afternoon. I'm not sure in yours because we have so many people in the country. And thank you for allowing me to be part of the wrap up. The project, as discussed today through this webinar, indicated that firstly, it was a multi-stakeholder participation, and it involved the veterinary statutory bodies of each country. And it teased out the issues that are between the veterinarians and the para-veterinarians, the VPPs, and those are continuing to be dealt with the VSPs in order to bring that relationship together into harmony, to ensure that there is no competition that is seen coming from the VPPs, for the veterinarians to understand this is an added workforce for the veterinary team. Secondly, the webinar indicated that the identification of the VPPs to participate was a competitive process that allowed all people, all the VPPs to come in and present and then be chosen. So that we got from the lesson learned from Bolaji. And we've already gotten the information that this is CPT accredited for all 3 countries, the program. So allowing for these VPPs in South Africa that are already part of the VSP to get those points, and allowing for the 2 countries to understand the importance of being part of a regulatory framework. And then the mentorship program and process, as presented by Sylvia, also indicated, although there were challenges and apprehension on unpaid mentors, but they were there and willing to support the project, and it worked well. And yes, there were still issues of the distance that sometimes prohibited the more engagement between the mentee and the mentor. And Nafina talked on issues of gender that were also brought into the fore, especially in South Africa and in other countries, in the other 2 countries, the issues of gender bias, the issue of when you are menstruating and you are not being allowed to come into contact with the animals, and issues of not being able to come into the kraal if you are a married woman, because those are issues that are for South Africa. Those were the issues that we are teaching the farmers and the VPPs how to handle those. And Jenny talked about issues of sustainability and capacitating the training institutions to be able to continue beyond the funding and the support by the current partners. And that again is a focus of this training. And we again talked about issues of the face-to-face practical workshops to augment the online training. And of course, from the VPPs that were trained, there was feedback. They were able to give what works for them, what should be improved, so that serves to improve the next cohort of the VPPs. I think that is my wrap up of the presentation of this. Oh, I forgot. The training was focusing on the additional skills that are not taught by the training institutions, because in the past, the VPPs were not allowed to work for own gain, and therefore the focus was on business skills, One Health, ICT, and gender issues. But again, what came out of this training was that now the VSPs have conducted the training institutions to ensure that the curriculum is improved, and these are taken into effect. Thank you very much for that. Thanks, Holly.
Thank you very much. Maybe just to wrap up, I'd like to remind everybody that today we've shared really only a small amount, the tip of the iceberg of what we've actually learned from this programme. And we do have 4 publications that we've released, and we've shared the links to them in the chat, and I think also the sign up for today's webinar. So don't hesitate to go on our website and download them if you'd like more information. or to reach out to anybody from the project team. Our emails have been shared in the chat. And also upcoming, there's going to be a more detailed presentation of our gender findings and the innovative response we've used to tackle these in the LD4D gender community of practice. So sign up to that community of practice if you're not there yet. And then finally, I'd just really like to say a big thank you to everybody. Thank you to Sebi for hosting us today, to sharing our lessons learned. Thank you to everyone who's been involved in the project, from the VPPs to the mentors, to the trainers, to the research teams who did the impact, the needs assessment at the beginning, to the veterinary statutory bodies, to all the associations. What we realised, it's a real team effort, and change doesn't happen, with just one person or one stakeholder. And I do think we are achieving change here, thanks to everybody's different inputs. So thanks very much.
Thank you, Holly. Thank you to all of the VPP team who came and presented to us today, and thank you for the audience. Your engagement has been excellent. This is obviously a very interesting topic to everyone, so we hope to see you again. We will be announcing the follow-up gender chat on the Community of Practice website, and we hope to see you then. Thank you very much. Bye.